Hi students, just a quick video, as I said I would do, to review both chapters 5 and 6 content in class, which was ICD-10 or diagnosis coding and CPT or procedural coding. So I wrote a few notes here and I'll put this video in the class so you guys can review it anytime you want. ICD-10 was what we went through in chapter 5. ICD-10, think of the D there, is diagnosis coding. It's the reason that our patient is here to visit us today. The chief complaint, lots of times you'll hear it called on the clinic side of things. And so I gave you a few examples. It might be the patient has a sore throat. We might just need a medication refill. It might be hypertension recheck. Okay. It might be headache. It could be pneumonia. It could be cough and fever. It could be a bunch of signs and symptoms. Okay. Anything like that. Okay. Degenerative joint disease of the left knee. Okay. Could be a fracture of the left foot. Okay. Code the diagnosis that's addressed today in this visit or for this service. Okay. I said it might be only one thing. It could just be that the patient has a sore throat and they want to make sure they don't have strep. Okay. It might just be one diagnosis. It could be a few things. You could have a patient that comes, we call them, oh, by the way, you make an appointment for that sore throat and all of a sudden, well, while you've got the doctor in the room, I have this left knee pain, I have a wart that I need frozen, I have a mole that I need removed, and I'm having hair loss or problem swallowing. Okay, it could be a bunch or a list of things wrong that day. Just depends on the visit. When you're coding diagnosis, or diagnosis coding or diagnoses is the plural, always start in the index, okay? In ICD-10, the index is at the front of the book, okay? We start at the front of the book. We find our diagnosis. Remember, it's alphabetical, much like a dictionary. And then we go back to the tabular to find our code and read through that code description, okay? Always check your code selection or code description in the tabular to make sure it's really the one that you want. Remember, we always code to the highest specificity, okay? Again, the index is at the front of the book. There are many, many rules. We didn't even hardly touch most of them. Most of them are ones you're not going to need to know in depth, okay, in your job description as a medical assistant, but you just need to know that there are many, many rules out there. In chapter 6, we went through CPT, okay, P for procedural type coding. These are all of the services that are provided to our patient for that date of service or this appointment time. You might have an office visit. It might be that they came in for their vitamin B12 shot. It could be that they need immunizations. They're there for their annual physical and pap smear, removal of a mole, freezing of the wart, x-rays. Maybe they just came in for chest x-rays today. Maybe they came in for blood work. All of those are reasons that the patient might be at this date of service or at this appointment time. Code all of the procedures that are done. All those services that are provided to that patient. Sometimes there's multiple. A patient might come in and have a visit. They might go to the lab and get their blood work done. They might go up to x-ray and have that done and come back to the room, and you might come in and freeze a wart. All in one day. Code every service that's provided. Every procedure, every code from the CPT book needs to have a diagnosis connected with it. We call this, and you'll have to know this term, I think, for your exam, we call it medical necessity. Okay? It has to make sense. Medical necessity is, we didn't take the appendix out. We didn't have an appendectomy because of a fever. Right? It doesn't make sense. We had an appendectomy because the patient had appendicitis or inflammation of that appendix. We did the throat swab, the strep swab, because the patient has a sore throat. Okay. We didn't do a throat swab because they have a sore toe. Okay. That doesn't make sense, right? That doesn't prove medical necessity. To get paid anymore, okay, everything's so lean. To get paid anymore, you have to prove medical necessity. There has to be a real reason why we provided that service, but it isn't going to get paid. Okay, medical necessity is huge. You got to know that term. Again, in CPT, we always start in the index, okay? But with CPT, it's opposite. Our index is in the back of the book, Okay, I wrote that there. Remember, ICD-10, your index is at the front of the book. So CPT is opposite. We're at the back. And then we go to your tabular to check your code selection or your description. Okay, remember in CPT we had those symbols. They were at the bottom of every page, so we didn't really need to memorize them, okay, or be tested over them because they're all right there for us. And remember, we also have modifiers in CPT, and they look like a 2-digit. I can tell you, I should have put that in there, you know, an example. Modifier 25, modifier 78. Modifier 51. They always have that hyphen or the dash and then 2 digits. We also have modifiers like that, right, and a modifier for left. Oops, I didn't get the hyphen in there. Okay, so they're not always numerical. You will see some that have alpha as well. I should write that in for I-10. We do have, I can't talk and type, alpha and numeric, okay, and your codes. In CPT, they are all, where am I at? Numeric. 5 digits long. Okay? There are 2 other terms that I want to go through. So make sure you know medical necessity, upcoding and downcoding. Okay? These are also a couple of terms that you need to be familiar with. Upcoding is a term, I said, that describes increasing your documentation, increasing those details to come to a higher level of service, which in turn creates that higher code level, a higher charge that we can bill, and a higher reimbursement that we can take in. This is fraudulent to do this, okay? When you were doing homework and when we went through class yesterday, you saw where if we were office visit, established patient, we had how many codes to choose from. And they went kind of in a hierarchy from the least or most minimal up to the most complex, okay? Increasing that documentation and increasing those details, bringing you to a higher level of service, okay, is very wrong, very fraudulent. Downcoding is the opposite, but still just as bad. Okay, that's a term that describes lowering your documentation then in details to come to a lower level of service, which in turn creates a lower code level, a lower charge, and a lower reimbursement, just as fraudulent. Okay, now I think when I graduated, I got really worried that if I coded something wrong, I was going to go to jail. Like immediately I'm going to jail. Who's going to take care of my family? You know, I was really nervous. Every facility is in charge of its employees, okay? If you do something wrong, and I feel like the words could be typed here, in good faith, okay? If you do things in good faith, can't type today, you can never be wrong. You can be educated, okay? Because if you do something in good faith and it really is wrong, but you didn't know that you were doing wrong, you can be educated and from here on out do things right? We can change, okay? You can fix the problem and now I'll do it right from here on out. So make sure, okay, that if you are doing something and you get rehabilitated or you get educated on the correct way of doing things, that you do then move on in the future and do things the right way. You're not going to go to jail. You're not going to pay fines. Facilities can be fined for their employees, negligence to their employees, not educating their employees. When you get into your position, schooling isn't over. Education is never over for us. As soon as you get into your position, there's going to be mandatory meetings that you have to go to that talk about how to do things at your facility and what's changing and how we should do this and how we should document that. It's constant, okay? Constant education out there. It doesn't just stop when you leave here at NICC. And that's a very good thing. Very good thing. So make sure that you watch this video. I'll put this documentation in the shared files as well for you, because this is a really good one to print off and make sure that you remember or to take with you, practice when you're taking your exam, you know, things like that. So make sure you ask me if you have any questions over either of the coding chapters or anything that I went over today. I'm here to help. Thanks.